what's interesting as we've been on this journey to deploy electronic health records, and as we do that, we've been in the process of also putting in portals in place for the consumer. And one of the things that we were driven to do to meet meaningful use requirements has been to put those portals in very rapidly. And at the end of the day, we've realized that they really aren't that benefit to the consumer that we are all expecting as individuals ourselves. And so it's really about revamping that and understanding what do we want as a consumer. I think the really interesting part is that we expect we can go and book a seat on an airplane, and we can pick our particular seat we want, the time we want to go, and there's a lot of complexity in the airlines. But yet in the healthcare side of things, we can't even book, in many cases, an appointment with our physician at the location that we want to be at and the time that we want to be at. And why is that? You look at it, and in the past, I think it's physicians really didn't want to release that schedule. Was it a technology challenge, or was it really just a case of I, as a physician, not necessarily want to divulge my full schedule? And we're finding that's changing. And it really is about the consumer expecting that now and wanting to have access to it. And also the physician realizing that it's not really different than the clerk scheduling the appointment, and that we can do it just as well as a consumer. For us, the consumer is demanding the telehealth presence of whether we have the ability to, schedule an appointment and be able to access that appointment on the phone, maybe even, that it doesn't have to be a drive-in to the physician office, or it's a consult from a higher level physician that can give that information, and that you want someone across the country, right? Because I want the best as a consumer of the patient care. And so it's that having that ability to go and get that access anywhere. I think the telehealth is really going to change the dynamics of the consumer and the expectations. And in addition to that, I think about my father's in Indiana and I'm in Phoenix, and how and I'm an only child. So how do you help give that great care and give that advice to those parents where, you may not live in the same city, but you still have expectations to assist and help with our aging parents. And so I think trying to find ways as providers, looking for ways that we can accommodate that and improve the care for our patients. Working for Dignity Health, we are very faith-based, very focused on it. It's not, we can't compromise on quality in order to meet the cost. It really is an underlying expectation that we have the best quality of care, and that's our focus. But at the same time, as the consumer and in the populations that we serve, sometimes can't afford certain things, but we can't compromise. So it is finding the most cost-effective ways to do things in order to meet that high quality that we all expect.